I have the pleasure of chatting with Dr. Skip Truitt. For those who may not know Skip, he has been teaching general dentists around the world how to do good quality orthodontics and how to diagnose correctly. I was very lucky to listen to Skip early on in my career. I'd already graduated as an orthodontist and was trained to do traditional orthodontics, and I thought that was it. And just by coincidence, I listened to Skip Truitt in Gatwick years ago, and what I learned in that one weekend totally changed the way I practice orthodontics, and for that I thank you, Skip.
Only a pleasure.
Skip, can you maybe for the younger members of the audience, maybe those starting their career, tell me how you see the profession changing, if it is changing at all?
Oh, it's changing dramatically, basically because of the internet. This classic orthodontics, 50, 75 years, sort of confined the market where no one really knew what was going on. And now a parent gets on the internet and finds that the child can be treated as early as 4 or 5 years of age and avoid all the problems. Plus, orthodontics is moving out of the field of just straightening teeth and understanding the temporomandibular joint and airway obstruction and all the things that go along with it, all the way to Tourette's disease. So it's changing dramatically.
I didn't have one lecture as an undergraduate in dentistry or as a postgraduate orthodontic resident on airway, which is just ridiculous, because I think you were one of the first persons to teach me about the depth and the width of the palate and how it can be affected by nasal obstruction, and we have to look at that. And, and that really, I think, is the key. Also, as you well know, most of the research that seems to be published in the field of orthodontics tells us that there's no link between orthodontics and TMD. And I mean, as a practicing clinician...
It's absolutely ridiculous.
Exactly. Can you shed some light on that?
Well, basic orthodontic literature is flawed from the beginning, because it's not really a study of anything other than what you can do with brackets and wire. And you're just limited to what you can do with brackets and wire and moving teeth, and that's about the limit.
And Skip runs an excellent course on TMD, where he talks about the correct diagnosis of intracapsular disorder versus a myalgic problem. So if you ever get the opportunity, I thoroughly recommend that component of Skip's course. Thanks again.
My pleasure. Nice to see you again.
Look forward to listening to you again. Thank you.
Same here.